Welcome back to another installment of this series on Basic Income Works, talking about what it is and if it does actually work. If you missed episodes 1 through 3, I really encourage you to go back and have a look. If you watched episode 2, there was a really important question that I talked about at the end of that episode. You probably remember what that was. I am working on it. That's a really big question to answer, and it is coming. It's coming later this season because it's really it's a deep one. It's an important one. If you don't know what I'm talking about, guess you're just gonna have to watch episode 2. All right, so for this episode, we're not talking about that. We're gonna talk about this instead. I've talked a lot so far about how well basic income works to get people unstuck from poverty, how it stops us from financially going in a sort of downward, uncontrollable spiral. But what about our health? We all deserve to, and of course want to, live happy and healthy lives, of course. But how does basic income impact that?
Yeah, so for a long time, I've been really passionate about learning about the plants and nature around me and providing accessible healthcare to my community. So I work as a clinical herbalist and help a lot of people with their health. And I also run a free foot clinic.
Kat is a medical professional working in very low-income communities in Appalachia. Many of her patients have nowhere to live and no way of paying her. Even with the financial difficulties that come with serving her community, she hasn't wavered in her commitment to providing affordable, accessible care. Her patients suffer from some of the most complex health issues, yet have the least amount of resources at their disposal. So she starts with the most fundamental ways to improve our health: food. Most people know this, but if you didn't, here it is. Many low-income environments are food deserts, which is to say the only food available or affordable is highly processed and extremely unhealthy. If you're unfamiliar with food deserts, one of the ways that I think about them is if you can imagine if you were ever on a road trip and you're kind of in the middle of nowhere and you come upon a gas station and you're super hungry and you're like, oh, I'm gonna go grab a snack. And you get in there and it's all kind of like dusty, expired, and it all just kind of looks kind of like dry and processed and full of sugar or salt or both. It's like not food. That's a food desert. And a lot of people live in neighborhoods and areas of cities where those types of resources are all that they have without leaving their immediate community to go find better resources for food. And why that happens, there's so much more. It's a deep rabbit hole. I encourage you to go down there. I'm not going to do it in this episode, but it is a really important thing to understand about low-income areas and how the lack of investment in them leads to, again, this poverty cycle. Okay, back to the story.
People don't have access to the type of food that I think would really heal their condition. We're just doing harm reduction. I'm like, okay, how can we reduce alcohol? How can we reduce sugar? How can we just get more colors on your plate? Just really checking in with where people are at and what they have access to and not judging people, because also people have a lot of shame and issues with food, and I don't want to ever trigger that. But it's so key to our healing, and so many chronic diseases at the root is inflammation or nutritional deficiency.
Kat is limited on what she can recommend for patients based on the money they have to buy healthy foods.
I've realized that a lot of these cases that come to me, I feel like the root cause of it is trauma, these autoimmune conditions and things like this. And so what I do is a lot of clinical herbalism. I give people medicinal plants. I give people nutritional and lifestyle recommendations. And a lot of times that does help in some ways, but not as much as I want to. And so I really want to expand my training.
Basic Income has been helping Kat both take care of herself and to offer more free healthcare in her community.
And so just receiving this money lately, I'm like, oh, I feel so much more able to just show up for Foot Clinic and do this work and show up for my community and feeling supported to do that.
So when it comes to health, money matters. And what I'm about to say seems intuitive and it makes sense, and based on all the things we've learned, you're not going to be surprised, but it is worth saying that people in impoverished communities are at increased risk for mental illness, chronic disease, higher mortality, and they have a lower life expectancy. And the largest group of people experiencing poverty are children. When we take our highest needs population and give them the least health resources, providers like Kat face extremely high levels of burnout. While basic income doesn't completely solve this problem, it helps to relieve some of the massive weight that she and her medical community are carrying.
I think what I need to feel compensated for is not what people are always wanting to pay for, because what I provide is like basic health care. So it's hard to ask for what I need, and so I don't all the time.
A lot of what ails our healthcare system is overutilization, because we've never changed the lifestyles that take us into the healthcare system in the first place. And that starts with your diet. What you eat is what you are.
When it comes to health, prevention is everything. If you allow people to have so little money that they cannot afford healthy foods or to sleep indoors, medical bills suddenly become enormous, and we all know this. Plus, the stress of not being able to make ends meet causes even further damage. I talked about this in episode 1, being a freelancer, being friends with a lot of freelancers, working with freelancers all the time. When people have very little, they make trade-offs. Trading off between having a roof over your head or being able to afford food. Having to live in a toxic situation because you can't afford to move. Those situations can eventually kill you. It's stressful and it's devastating to your health. Here's some research out of Tufts University that showed that providing Americans with nutrient-rich foods would avoid 1.6 million hospitalizations, with a net savings of $13.6 billion each year. Basic income experiments in Canada reduced hospitalizations and admissions. Participants reported improved physical and mental health. When you have money, especially at the community level, you can take control over your own destiny. We move away from a model where we must beg, ask for charity, towards one of empowerment. $1,000 a month, of course, isn't enough to solve all of your physical and mental health problems, but it can be the boost you need to turn your life and your well-being around. Do you agree? I, having experienced it, definitely do. If you're enjoying this series, you want to know more, I am going to continue answering questions. This is only episode 4, so go ahead and subscribe. I'll see you for the next episode. If you're binging, that'll be in like 5, 4, 3, 2, 1. Thank you and be well.